most importantly, how you give such a wonderful direction to healthcare, meeting technology, but having the humane touch. And that certainly, if every doctor follows that approach, I think it will change the face of healthcare in India. I broadly want to pick up from the points that you've mentioned here. To understand that medicine is now moving at lightning speed, where do you see the most promising breakthroughs when it comes to digital health, precision medicine, regenerative therapies, or even something else? You can take that mic.
Thank you, Sudarshan, for having me here. There are many things that have happened in the last many years, and as I said, we were blessed to witness the change. I think people of your age probably have not seen what it was 50 years ago. So everything would be something that you have seen all through. But we have seen, I have traveled in cars that ran on gas, to cars that ran in petrol, and now cars that don't need any petrol. So also healthcare has certainly come a long way. Just to mention a few of the changes that have happened. One, I did mention you the story of telemedicine, which has made a huge impact because we have a large number of patients coming from far-off places. And when I say far-off places, I'm sure our Deputy CM will be the next speaker. Even in Bangalore, coming from Kanakapura to Manipal Hospital, Bangalore, I would consider it as long distance. It takes 2.5 hours. So patients curse you because they have to come and wait for you. So I think telemedicine has made an impact. And it's also very useful when you have a post-op patient who doesn't have to come back repeatedly after the surgery. So many things that you do on a day-to-day basis, except actual surgeries or procedures, you can do with telemedicine. The second, I think, is what I mentioned is the remote monitoring and wearable devices. You now have devices like the iWatch, iPhone, the Ring, health Ring, and the continuous glucose monitoring, which has made life so easy. We used to have diabetics who go into hypoglycemia at midnight, and morning when they wake up, they have very high sugars, and then you increase the insulin because what you have seen is high sugar. But by and large, what they needed was actually decreasing the evening insulin. That is very easy for us to monitor with the continuous monitoring device because that will give you a graph of how the sugars were 24 hours in the day. The second thing is I had a very interesting, true story of a lady I know very well who was about 70. She called me at 4 in the morning. Nowadays, because of my age, I don't take up phone calls in the morning because she was a friend. I took the phone call. She said, doctor, I feel a little uneasy and my iWatch is showing that my heart rate is fast and it's irregular. So I rushed her to the hospital nearby, which happened to be one of our hospitals. And lo and behold, when she came to the hospital, she had a condition called atrial fibrillation, where the rhythm of the heart is lost and the atrium starts fibrillating instead of pumping. And your ventricles respond by extremely fast heart rates. And then your cardiac output decrease, you feel dizzy. And it was promptly treated and she went home the same evening. And this could have been a disaster. She could have had a stroke. She could have lost her life. But the iWatch literally saved her. So these kind of things, we see it all the time. And during COVID, when the hospital was chock-a-block full, we had to send back very, very sick patients. We had to clean up the hospital beds. And then home monitoring of vital signs, including the pulse oximeter, became a lifesaver because we didn't have to admit people who were relatively stable. So all these things, I think, have made a huge difference in how we manage chronic diseases, including diabetes, hypertension, heart disease, lung disease, so on and so forth. Now we have the watches that monitor everything. My watch can monitor my oxygen, my heart rate, and so many other things. And now there are watches that can also measure your blood pressure, so on and so forth. So you really don't need any gimmicks or gadgets to do all this. Your iWatch is good enough. The third, as I said, was robotic surgery. Huge difference it has made. It is easy for the surgeon, and sometimes people mistake that the robot is operating, and that's where I said that doctors are still needed because the robot is guided by the doctor. The doctor may not be in the vicinity of the patient, though usually conventionally they're in the same theater. But we did have an example of our surgeons in Delhi operating on a patient in Jaipur. So it's possible, and actually transatlantic robotic surgeries have happened from the US to some country in Africa. So it's possible, technically it's possible that the surgeon would guide the robot from long distance as long as you have good connections. Then, of course, we talked about xenotransplantation with genetically modified pigs. organs can be harvested for organ transplantation, then stem cell therapy, so on and so forth. So the field is huge. So I feel medicine will be very different in the next 5 to 10 years from what it is today.